Now, ketamine, because of its history of abuse, it was in 1999 became DEA regulated. It is a class 3 non-narcotic in the same DEA class as, say, testosterone supplementation, and for the same reason, for misuse and abuse. But
and now these were people basically illegally
they were illegally getting it.
Okay.
Yeah, it's because before it was DEA controlled, it was just on the shelf at the hospital. People could take it, and because it's such a safe anesthetic, anything that makes people feel weird, they'll abuse, and that was it became a popular drug in the party scene, and that's where, unfortunately, a lot of people have heard about it. They hear the term Special K, or one of its other names.
You're listening to the Nutrition World Podcast, a show about navigating the intricacies of holistic wellness. We're a natural health food store located in Chattanooga, Tennessee, and we believe that optimal health and peak performance should be accessible to everyone.
Welcome to another episode of Nutrition World's podcast. I am stoked today to have Charles Miller from Scenic Neurotherapy with us for Nutrition World's special edition of ketamine we're going to speak about. Welcome, Charles.
Thank you so much for having me. I'm very excited to be here.
I feel like I'm an explorer in certain ways, and I have been my whole life on one single topic, and that topic is health, recovery from illness, nutrition, foods, supplements, even some in the medical field of, proper medications, whatever I can do to empower people with kind of outside the box thinking. I've been listening to a great book by Dr. Peter Attia, I think it's called Outlive, and he frames things in medicine 1.0, medicine 2.0, and medicine 3.0. And in medicine 2.0 is the traditional model that we are kind of stuck in most cases, which is there's a toolbox, there's a certain protocols, and that's it. We're going to put a code to your disease. This is what you're supposed to do, and go home, and we'll see you in a few months. He's talking about medicine 3.0. I kind of live in the health 3.0 or 4.0 my whole life, which is searching for options when we can't find really good solutions in what's already available. Many of us have heard about ketamine therapy. It's certainly been around, and you're going to talk about the history of it and the benefits. And I will say, and I don't really talk too much about this, but I'm going to on this podcast, I guess I would call myself an experienced person within IV ketamine therapy. And I have a lot of feelings about it, positive, a lot of different, I think, help for people if they wanted to ask me about how does it work, what does it do, what does it feel like. I could personally, I think, be able to help, and I'm happy to. But first off, to tell the people who don't really know, and before I even mention that, we're going to talk about something that has applications for PTSD, anxiety, depression, bipolar, long COVID, kind of inner-seeking, peace-giving type of therapies for the right person. And I really, really respect you, Charles, because this was not a journey I took lightly. It was something because of the power of it. And I'm so into, natural and nutrients and foods. And this doesn't fit into that box by any means, but it fits into a box that I'm putting big stars on. So tell people, what is ketamine? And then we can go into some of the applications.
All right. Well, ketamine is a dissociative anesthetic. It's been around since 1970 when it was initially FDA approved as an anesthetic analgesic. Has been utilized pretty much continuously over ever since in the surgical setting. It's our primary anesthetic for children 6 months and older. It's the safest anesthetic that we have. It's non-opioid, non-narcotic, and one of the World Health Organization's 100 essential medications. Now, ketamine, because of its history of abuse, it was in 1999 became DEA regulated. It is a class 3 non-narcotic in the same DEA class as, say, testosterone supplementation, and for the same reason, for misuse and abuse. But
and now these were people basically illegally
they were illegally getting it.
Okay.
Yeah, it's because before it was DEA controlled, it was just on the shelf at the hospital. People could take it, and because it's such a safe anesthetic, anything that makes people feel weird, they'll abuse, and that was it became a popular drug in the party scene, and that's where, unfortunately, a lot of people have heard about it. They hear the term Special K, or one of its other names. that have been circulating out there. But it is actually an anesthetic that produces a powerful dissociative anesthesia, which a dissociative anesthesia is not a sedating anesthesia. It doesn't put you to sleep. It puts your brain, separating conscious and subconscious areas of the brain. And we usually don't use it by itself. It's usually a complement in surgery in combination with other anesthetics. But the use that we use it for is to stimulate a process using a very unnatural medication, ketamine. We stimulate a very, very natural process of neuroprotection in the brain that stimulates large-scale neuronal regrowth. And that's the goal of this process. And what we've learned is that there's many facets to what that looks like, from a patient's perspective all the way to what we can image with a functional MRI or SPECT scan.
So neuronal growth, that would equate to clearer thinking, less fogginess, better memory, maybe sharpness.
Yeah, it's like an upgrade of the brain.
Upgrade, yes.
It's by enhancing connections, it's like if you have a computer that's running 10 programs all day long, over the lifespan, your processor, your brain, there's actual physical wear and tear with stressors, periods of heightened stress, initial traumas, long bouts of depression. Multiple things can cause over the lifespan, heck, even viral illnesses like what we see with COVID, cause a measured level of neurodegeneration. And depending on where these areas break down, it determines how they manifest. We've seen patients develop new onset pain disorders where there's no injury after a COVID infection or after periods of heightened stress. Fibromyalgia is a common diagnosis that we see out there. And it's the brain sending a hyperinflammatory response to the body when there's no actual injury. It's like an overreaction. It doesn't happen to everybody that experiences stress, but there's a portion of the population that are prone to develop a pain disorder. Then excessive anxiety with something that should produce anxiety. Crossing the street should produce anxiety. It's what makes us look left and right when we cross the street. But the brain can sometimes have an overreaction to it, especially if we're not processing things correctly. So your computer that runs its 10 programs, once that processor takes a hit through just the normal wear and tear of life, the brain, now the processor is not able to run the 10 programs effectively. The 10 programs take the same amount of energy all the time, but now it can only effectively run 8. So you end up getting behind. Life starts getting harder. Small things start to feel bigger. By enhancing connectivity in the brain, upgrading the processing power of your computer, we are still running the same 10 programs. They all still take the same amount of energy as they did before, but the system doesn't get bogged down.
I love that. And I know it, and tell me if this is true. I mean, I think most of us, as we age, we start seeing things that are obvious to our decline of health. We lose muscle, or we can't have the endurance. We don't have the sense of well-being. We have less stamina, but we can't look at our brain. And the looking in the brain part of it is it shrinks too, doesn't it?
It does.
And then the other part is becoming less efficient. Now, there's a point where we know that's happening, but we've wasted 10 to 20 years by the time that it's that obvious. And of course, I'm so connected with the impact of the right foods. I think food is the best and strongest medicine there is, but also the lifestyle of sleep. And then thirdly is nutritional supplementation. But that still, as good as it is, I want to access everything else that's possible when I weigh out risk against benefit. And in me, that's very important for me to give people advice and also for my own personal life. And when I looked at ketamine, because it kept coming into my view over and over and over, and I really believe in synchronicity. And so there was a moment, and it was partially because I had hit pain, not fully, but because I hit pain and I saw something about maybe it would reduce that, because we have to know, and most people don't, you really don't have pain in the body. The pain is up here. The brain is producing the pain signal. Yes, this could be hurting or broke or damaged, but really and truly, this is where it's really established, and it can get locked into a pattern. Dr. John Sarno is one of my big heroes talking about that, getting locked in patterns of pain. And so I went to you. And, I have to say before I did my first IV treatment, which took about an hour to complete that morning, and you'd done a great consultation the week before on that, I was a little bit uptight. I mean, I had no clue. I am a serious meditator. I am a person who believes that I can have a lot of thoughts that I take as real, but they're really only relatively real because it has to do with my programming, my position in life, just what I've been taught. Is that really authentically real? Most of the time it's not. Well, I wanted something that would kind of take me down the journey of kind of me able to stand back and look at this inner conversation that Edward Jones has and kind of decipher it. Is, the importance of what am I telling myself every day? Is it really black and white and concrete, or is it gray? And so all of that in my head said, well, my hips are hurting, so I want to see if it can help that pain. But I also want to see if I can go on an inner journey. And I'm also an explorer because I want to know what it does for my occasional anxiety and my thinking patterns. And so it was the perfect fit for me at the time. And this was about a year ago when I started. So all of that said, that's kind of my personal story. I still do the IVs because I'm like you. I want to be, what was the term you said? Be my very best?
Yeah, the best version of ourselves.
Best version of myself. And that plus my lifestyle. And, we rent these bodies. I could expire tomorrow, but I've done really dang well for 66 years at this point. And so as far as all these people who have, not feeling they're being treated with or getting results with the treatment per se with depression and anxiety, what percent of your practice is that?
I'd say it's about 70%.
70%, okay.
The problem is, and I've mentioned to you this in many of our conversations before, is that specifically the mental health population it's an underserved population. I think that comes a lot due to the expectations. It's like when we go to a doctor, we expect to get better. Mm-hmm. When we go to seek out medical treatment for what we've been told is a disease process, then we go get that, go get the treatment that is recommended by the experts. Well, in mental health, it is treated like a palliative care. It's like we address the symptoms. We don't ever look at the underlying issues. Now, with psychotherapy, that's where a lot of the real gains are made, like exercising a muscle, the emotional muscles, working through processes. It's a wonderful tool, but it is limited by the actual anatomy of the brain's ability to structurally process and put away as you work through things, being able to actually make the gains in psychotherapy. With our process, especially for my mental health component, the psychotherapy is like the physical therapy after a knee or hip replacement. Mm-hmm. It's so important to make sure that once we get the anatomy correct, that you're actually using it in the best possible way and getting the gains through the work.
And what does that look like for a potential patient? How many sessions? How often? What does it look like?
Yale gave us a wonderful template back in 2011 when they published their findings. They did a 10-year study, thousands of participants. We looked at neuroregeneration in this group, and what we found is that after 6 infusions, we found that 92% of patients reached optimal neuroregenerative ability over the short term. That doesn't mean that we keep it, because what tears down these processes is often what we're doing every day or what we're not doing to take care of our brain and our body. And so there is a process shift. So what we do is we get the anatomy correct. We do 6 infusions, usually over a 2 to 3 week period. And then moving forward with psychotherapy, just like we would with physical therapy after we corrected the anatomy, working with daily self-prioritization, looking at the small things in your day-to-day life, areas where you can improve from health, nutrition, quality of sleep, work you're doing in psychotherapy, practices, coping skills, healthy outlets. All of these things have to be addressed to get the most out of our process. We cannot keep doing what we're doing and expect different results. Even when we get the anatomy correct, you'll get better, but you won't keep it unless you make changes.
Is there a maintenance for people who are putting the plan together?
Yeah, people will do boosters. And because what we do, there's no potential for dependency. There's no need for a wean off. And the dose of ketamine that we use is passive enough to give to a 3-year-old. It is very safe to utilize as the patient sees the need, because we don't have a blood test that tells us how you're feeling or how you're coping. There are periods of life where you may come get boosters more frequently, whereas other periods of life, you're doing fine. And the need for boosters, you're kind of like, I guess I could have a booster, but I don't I'm okay. So as far as minimum need, like need as, to keep you the best version of you, usually it's, people will start out once a month or, every 2 weeks to once a month after finishing stabilization, the 6 infusion process. And then as they see fit, they usually start rolling it back at that point, usually 3 or 4 months out, to where they're eventually get to a point to where we're just a tool they have in their back pocket if they need us.
Well, 2 questions. One is, are there people who it's just not comfortable for them and or not effective? And secondly, we got to talk a little bit about pricing, because I know people listening will want that. So is there a small group who just is not compatible with this therapy?
There is. Certain dissociative identity disorders, certain people who disconnect completely with reality in the outpatient setting. There has been some literature that shows that certain personality disorders, schizophrenia, schizoaffective disorder, these diagnoses are not ideal for our process in the outpatient setting, because reality or baseline, when you come in, is where you return to. Well, if that's a flexible place, then we're probably gonna, it's in an inpatient setting, it can actually be beneficial. In an outpatient setting, not so. It increases the risk of problems beyond when you're with us, and so we don't treat those patients in the outpatient setting. But otherwise, depression, anxiety, PTSD, bipolar, OCD, the myriad of subtypes that come under that from a mental health component.
Does this mean that they have to, and I know they should, if they're being treated by a psychiatrist or someone else with medication, they would be consulting him before they did that, him or her, before they did that, right?
I encourage having everyone involved. What we do is developed by the best minds in psychiatry. Yale's Department of Psychiatry, Johns Hopkins Department of Psychiatry, Stanford, Oxford, and the National Institute of Mental Health considers ketamine given intravenously.
And that's right. And let's talk this, and then we'll get to the price. So intravenously under medical supervision, like you do. You have me hooked up. You're watching me with a camera. You have my blood pressure. What else? You have blood pressure.
Heart rate, blood pressure, respiratory rate, oxygen. Continuously using that specialized caretaker monitoring, which tells us your vitals second by second, not just periodic checks. Self-administration of anesthesia is a bad idea. It's become a very popular idea. With COVID, they relaxed the rules on controlled substance prescribing. And with that, somebody got a really good idea as far as how to make money is let's take this IV ketamine data and apply it to other forms of ketamine, sublingual, intranasal. The intravenous model is the only one that produces this neurogenesis, which is the goal of our process. Now, if you're looking to feel different or feel strange, then the sublingual will do that. But we have to hold therapeutic blood levels to a certain point for an extended period of time. And the only way to do that in a reproducible and ensure best results is with the IV model.
I know, because on Instagram, I'm seeing constantly these ads for, are you a candidate for this? It's ketamine, and, just contact us. And I think what you spoke about, I think many industries, including ours, uses borrowed science. They'll look at a really great study, but then they won't really duplicate it. They'll go to their furthest cousin of that ingredient and say, you should be doing this to get this result. And it's just not possible, usually not possible to do that.
And the struggle we have is that the IV model is more labor intensive. We can treat fewer patients because of that. We have a set limitation at our clinic on how many patients per provider in office we will treat. There's no legal limitation, but we do that from a safety perspective because my role is to ensure always efficacy, safety, comfort. That's my role here, is to ensure all those things come together.
You do such an extremely good job. You have such a safe space is what I would feel like and say as far as words. And it's very important if you are kind of transitioning into this journey of kind of separating your ego from the personalities or whatever people feel the words are appropriate. You don't want to be in an unsafe space for that. Now, I've done so many of these now, and I just have to say I look so forward to that Thursday. Every other Thursday, I'm like, yes, this week is the week. So I don't know how long I'll do it, but I will as long as I can continue that, most likely. So cost-wise, what are we looking at? And you've already said it is labor-intensive. It is. I can tell I'm a businessman, number one. Number two is, I'm there for 2 solid hours or almost. You have to give me like a little office, and you have your people monitoring. There's a lot that goes into my little 2 hours. I know that. And in between, you come in and you're removing the IV, and you're helping and just making sure everything's okay. That's a lot. You have 2 or 3 people are like helping me to get through this every week, which is no real help. I don't need help, but it's what's the cost?
Yeah, it's the cost is. It depends on which treatment we do. The baseline treatment, the mood or the basic ketamine infusion therapy is $395 per infusion.
Okay.
It has been, I think we started 4 years ago at $350, and then last year we finally made the bump because of the increase in cost of materials and everything. It's been rough with COVID. Getting materials, and the cost of everything has gone up tremendously. And so we ended up raising our prices to $395 per infusion. One of the things we are excited about is that we're seeing better and better insurance reimbursement.
Really?
It is not something that, it is something that is still a little more labor intensive, and it involves the patient. We create super bills for this process to where we pre-code a couple of features of your infusion that are insurance reimbursable and that your insurance should cover. Ketamine infusion therapy doesn't have a CPT code for insurance yet. It's an off-label use of an anesthetic. And when something's off-label, insurance can pay for it. They just don't have to. And if they don't have to, they usually won't.
Okay.
But what they do pay for is the appointment. They can pay for a simple infusion, which from what we see is somewhere between 20 to 40% of the patients out of pocket they can get back.
Oh, really?
Using their health insurance. They have to file the super bill with their insurance, and then usually within anywhere from 2 to 4 weeks they get back either a check or it comes through us, and then we send it back to them. But it is increasing access quite a bit. We also, for patients where coming in to do 6 infusions at $395 per infusion, that's $2,370 for the stabilization of 6. I like to be very upfront with our pricing too. I don't want it to feel like a timeshare. You got to come in and talk to find out what it costs. All of this is published on our website, so you can see everything before you come. But with that lump sum, that's difficult. That's a lot of money for anyone to throw down. And so we are in network with Care Credit, and we subscribe to their deferred interest program, which makes it to where the patient, when they come in, they're going to pay just the amount of treatment. As long as they pay it off within 2 years, they're not going to pay any interest. And I like that. I don't feel like people should have to pay more just because they're, just because they're not able to drop $2,000.
I love that. And I know, being a businessman, that is not unreasonable pricing. I know what goes into your overhead. I know what it has to be to make a profit. And there's no, sometimes some people think it's, not profits are not that important. That's the only fuel that runs this ship. It runs my ship, runs your ship. We have to be able to pay bills, and to do that, we have to be efficient, and we have to charge the appropriate amount. And I feel totally confident you are charging the exact appropriate amount. Now, I know people listening will say, "Can I try one session for $395?" What's the answer?
The answer is no. And the reason being is because it's a process. Ketamine infusion, you're not buying ketamine. You're not buying an infusion itself. You're buying the ketamine therapy. And the minimum standard according to the science, according to the peer-reviewed literature, to get even the basic benefit from this process, you have to do at least the stabilization of 6. This isn't a boutique service. And for many patients, this can be potentially life-saving. And that's, it's a lot to commit. And we understand it's not just money, it's time. You have to have a driver to each infusion. So it's not just the patient's calendar, our calendar we sync up. We have to bring in a third party. Somebody has to drive you to and from your infusion because it is an anesthetic. And for a couple hours after, you're still a little slow to respond.
But the good thing is, it is literally only a couple hours.
Yeah.
I go in there at 9 o'clock. I walk out at 15 to 11 with my ride. We go to Jason's Deli every time. I eat because it does make me hungry. And I don't know if it does everyone. And then I'm back to work at 12 o'clock. I mean, it's cleared my system. It is amazing how now, I won't say that I'm 100%, like I wouldn't go fly an airplane at 12 o'clock, but I'm fully functional and thinking clearly. And sometimes I'll actually do a podcast at 2, or I do my radio show sometimes just 2 or 3 hours after. I'm doing very well with that. And I think the more I do, the more I'm feeling the smoothness, I guess I will say, and the benefit from this therapy. I know it's cumulative. One, you've said that before, and I am on an every other week protocol now. First, I did one a week because we work more focusing on my neuropathic pain, and you have a hybrid is what you call it, isn't it? What is that? A hybrid IV?
A hybrid infusion is we call it a ketamine infusion, but ketamine is just one of the many adjuncts that we put into the infusion. It involves ketamine, lidocaine, magnesium, steroidals, non-steroidals, even antihistamines, and we attack inflammation systemically in the body from a multimodal approach. Multimodal approach allows us to use less of each drug, which minimizes potential side effects, but gets us greater gain because of the complement of all these drugs working together.
I love that. And did it help me? Yes, it did make me feel better, but my hips were totally basically gone. And no one could see that on a basic x-ray the first about a year and a half, 2 years. So we really didn't know that I was in the state that I was in. So you can't fix flat tires on a car with just a half a can of spray and expect it to roll down the interstate again. That's where I was. But I did have, like, after my hip surgery, it's been now, I think, 8 weeks, I did one hybrid. It was unbelievable how much better I felt. It was truly, to me, a turning point because I did not want to use those drugs. I used 2 pills of those drugs that were prescribed because I know the dangers of those. But when you have enough pain, you'll do anything.
Yes.
Well, I had that enough pain, and it just happened to be my day to come. And from that moment, that one hybrid, it took my pain down 50% that never returned because I think I was having a tsunami of pain just because of everything, the surgery. And it just turned off switches that were just beautiful for me.
Well, it's inflammation. Everything kind of boils down to inflammation. Even there's been a whole lot of data coming out in the last couple of years on the role of inflammation in mental health.
Oh, really?
Yeah. It's fascinating.
Because we talk about all the time as far as chronic aging and all the things that happen. That's why I check or recommend everyone to check certain parameters on our blood work. The C-reactive protein and some of the other indicators of too much inflammation. And inflammation doesn't always mean pain.
Right.
Then that's the thing. I don't have pain. That doesn't mean your arteries are not inflamed. Your brain's not inflamed. And we can do markers like C-reactive protein and see some of these and may have do others. But yes, so I didn't know that it was really that indicated for mental.
It's an exciting look at the way our brains process things because even though feelings and emotions and the spiritual nature of us, everything we think and feel and are boil down to billions of synapses that are all communicating, to create this image of who we are, which is what we call ego. This person that exists inside of us, but the thing is that you can have a traumatic brain injury. It can change your personality. It can change foods you like. It can change how you address the world, how you walk, talk, everything. It is our thoughts and feelings are physical in nature. And what happens with periods of heightened stress, say emotional stress, we see hyperactivity of the neurons. Hyperactivity causes increased blood flow into the brain, and the skull is this locked-in shape. It doesn't expand and contract with increased blood flow. And when there's more blood flow into the brain, tissue, cerebrospinal fluid has to exit. And so to prevent injury or damage from increasing intracranial pressure, the brain will actually shut off or disconnect areas through a process called dendritic regression. What causes the dendritic regression is the hyperactivity, and the hyperactivity manifests like inflammation. And so seeing that inflammation, we can actually, being able to image or see activity in the brain and understand those are hyper-stimulated or hyper-inflamed areas, we can anticipate these areas not functioning well later. Ketamine itself decreases circulating cytokines, which are inflammatory mediators. That's one of the unintended side effects of ketamine, but most of our anesthetics are anti-inflammatory in nature. And so the approach we use, say with the hybrid infusion, is the ketamine works in the brain. Everything else works in the body, the periphery and in the spinal cord that we use, but it's all designed to take down systemic inflammation. The brain is stimulating neurogenesis or the ketamine is stimulating neurogenesis in the brain while everything else is decreasing inflammation in the body, basically resetting the system to not avoid pain that should be stimulated because pain is important. If something's wrong, we need to know it. But like in your case, once we fixed the underlying issue, we were able to reset the way the brain was sending those signals to where you felt the pain that was there, not the inflammation pain from your surgery.
And I don't know if you said it or if I've read it, but to me, the more mental part of ketamine therapy is just like my daggum cell phone that gets slow and clogged up, and I do a reset, and it starts working the way it's supposed to when I bought the phone. And that's what I feel, or certainly did in the first 20 or 30 IVs, is I felt a true reset. It was almost like I got rid of like some garbage that was been piling up in the back room, and I finally just kind of cleared the house out, and I walked in, it was like, this is so much more peaceful because this stuff's been bugging me for a long time. It's not thoughts. It's just some burdens. I don't know. It's hard to describe. So is there anything else in that IV other than ketamine?
It is. We at Scenic Neurotherapy, we utilize a special process called minimally stimulated ketamine infusion therapy. And that is a whole protocol, and it includes ketamine in the basic infusion, but it also includes NAD plus therapy.
I love that.
NAD plus therapy it's a simple vitamin infusion, can be taken orally, intravenously. There's multiple ways to take it. The most bioavailable, or the best bang for your buck seems to be IV. And so we include that as a component to ours because it complements the neuroregenerative process, stimulates ATP production in the body, which is your body's energy source, helps your body, for everything from muscle contraction to clearing waste products from the brain and muscle tissue to just rebuilding you as a whole. ATP is a necessary component. And so making sure the body has the building blocks it needs to make the most of each treatment, it pushes the patient just that much farther. And it's part of the minimally stimulated ketamine infusion process.
I love it. And I remember you telling me that on first day I went there, and I've really delved into NAD for probably just 3 years because it's kind of risen up in just the past 3 or 4 years. It is one of the most probable components that can slow aging or slow damage of aging that there is in the whole toolbox of us and you and all this. And the fact that, you're willing and brave enough, and I have to say, people like you have to be brave because you're fighting a stream and a current that isn't really conducive to these out-of-box therapies, and you had to get some peer pressure. You had to get some negative comments, and I've never asked you that, but I know you did. Yeah. I mean, as I do. I mean, I posted a TikTok the other day on how to lose body fat, and people were so insulting to me. I mean, they just give you these bad little negative comments, which really doesn't bother me anymore, thanks to ketamine. Thank you. But you're a brave soul, and Chattanooga is very blessed to have the fact that you are following your passion in this town. And just to have an IV of NAD, I would travel to do that alone. And it's just an add-on, a perfect add-on, because you think outside the box and you want to help people. There's one thing about your clinic. Your number one number right there at the top is, I want this person to leave better than they're coming in.
Of course.
And that is the same with Nutrition World too. And we are not the most common. I mean, these are the people we need to find. And I always say we need a team approach to have graceful aging. And that team approach is not the person who just studied textbooks in school. We need people who have not just knowledge. We have people who need passion, compassion, and wisdom. That's not always easy to find. I certainly feel that you are in that boat. So tell people, if they want to contact you, how to learn more, what can they do?
Well, the best thing to do is go to our website, sceniccity.neuro.com or sceniccity.neurotherapy.com. And just see what this is about. See if this is something that speaks to you. Look around the website, all of our pricing, our scheduling, all of it's on there. And then when you're ready, how you're ready, you can call our office at 423-228-0579 and speak with Connie at the front desk, who is always a joy to talk to. Or you can even just submit a form on our website, and then Connie will reach out to you. It's whichever way you're most comfortable. It is the most important thing is to make sure that we are doing the best we can for our bodies, for our brains, over the lifespan, to keep us the best version of ourselves as long as possible. Unfortunately, we live in an imperfect world, and it's a fight we're all going to lose eventually. But the goal is to keep as much good as long as possible. And that's where neuroregenerative therapies like ketamine infusion therapy, transcranial magnetic stimulation, many of the different new neuroregenerative therapies can kind of push forward in a place that hasn't made a lot of progress in the last 70 years.
And again, I'll go back to risk against benefit on all things, including nutrients. The risk of ketamine is so low, the risk of benefit is so high. That's why it needs to be at least considered in people who, one, certainly do have the financial ability to do it, and secondly, the people who have needs to do it, which is tremendous amount. And I do believe that back in, we call the old days, I guess, when we had a lot of nature time, downtime, no social media, a community of caring, loving individuals around us, those were all therapies in itself. That helped us immensely, not even talking about the foods we eat or anything else. We don't have that anymore. We are having to counsel ourselves almost on so many areas. And I find that ketamine has allowed me to be a better friend to me. It really has.
I like the way you said that.
A better friend to me.
Yeah.
So thank you so much, Charles. I've been wanting to do this because it's so part of my passion to empower other people with options. So thank you for joining us today for this wonderful podcast.
This has been a great conversation. Thank you so much for having me.
All right.